Yes, how I got into aesthetics. This started about 7 years ago, where I had a dental problem whereby I needed to have a procedure or surgery done on my dental area. This was quite a major thing because it involved bone and so on. I was in theater for about 5 hours or so. It was medically indicated because that problem with my dental setup was affecting my health. So after I was discharged, I had changed a lot in terms of appearance. There would be loose skin here and there. So I started having to attend aesthetic practices or, or to do aesthetic procedures to correct my face. Then the interest developed, and I thought, this is something interesting. I could do it because I saw me changing from looking a bit strange to being my old self again. So the journey started around about 2016.
All right, doctor, can you tell me the difference with the medical aesthetics that are available out there, the difference between Botox, etc.?
Yeah, I know that everybody, when we talk about aesthetics, they think Botox. Botox is just one of the components in aesthetics. Uh, Aesthetics involves everything from the texture of the skin, and we advise people on how to treat their skins. It also involves anti-aging, whereby we rejuvenate the face. And most importantly for me, is about prevention of premature aging or delaying the aging process. That's very, very important. And we also emphasize that this beauty that we are trying uh, 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 to talk about is not only outside beauty, it is also inner beauty. So we move towards an issue of a lifestyle, healthy eating, exercising, breathing a lot of fresh air, drinking a lot of water, and then the outside, which involves now your anti-aging, your Botox, your fillers, your facials, your microneedling, your the whole lot. There's quite a lot of things, but it's very important that you don't only treat yourself from outside, but it should be inner and outer beauty.
Now, what does this do for general confidence, and why is it important to be confident?
It's very, very important to be confident because when you look good, you start feeling confident and you act confidently. I actually was not aware of how much this issue of confidence impacts on women. I've got women who come to me with their problems, and when I ask them how can I help them, when they describe what they are going through, they just break down and cry and sob and sob and sob. It's only now that I'm in practice that I realize that really this is an important and essential aspect of healthcare for women in particular. But we do get men as well, by the way.
That was my next question. What would you recommend for somebody like me? So men can go, but what would you recommend for me to do? What could I do?
What I've observed about men, they don't look after their skins. They just get into the shower and they'll apply on their face whatever they apply on their body, and they go. Men need to also look after their skins because when you address people, the first thing that they look at is your face. And if your face is easy on the eye, they tend to be more interested in what you are going to say. So you need to go for a consultation. We assess your skin, we analyze it, and we recommend the treatments that you should have. Especially for people like you who are working with the public, you have a lot of facial expressions. When you talk, you use your facial muscles a lot. Eventually, those muscles, they become static lines on your face, and then you tend to be older than your actual age. So it's very, very important to look after that skin and to treat any early signs of aging.
Doc, is there a lot of women empowerment within the aesthetic industry? Are we seeing more and more women in that type of industry?
Empowerment. We actually are empowering ourselves. We meet at conferences because there's a lot going on in the aesthetic industry. You get conferences. Unfortunately, this year we haven't had any because of the corona. But we do a lot of webinars and Zooms and so on. We meet at these conferences. We check to each other. We've even got WhatsApp groups whereby we share information, but nobody's really empowering us. We are empowering ourselves. I must say, the pharmaceutical industry of the products that we're using, they are quite helpful, some of them. They will call us and do a bit of in-service training here and there, and that's it.
I'm also thinking, when I think of the words Botox and plastic surgery, etc., I think of a lot of white women being involved in that. Is that something that's slowly changing? Are we seeing more African women being involved in things like aesthetics, and Botox, etc.?
Absolutely. There is a new trend now where African people, African women are very much trending towards aesthetics. And one thing I can say, plastic surgery now is actually slowly being replaced by non-invasive or conservative procedures like your fillers, your Botoxes, your plasma-rich plasma facials, the so-called vampire facials, where Kim Kardashian is popularly known for. All those things, they bring rejuvenation and a fresh appearance on the face. Because what they actually do, they promote the formation of collagen. Collagen is what makes us to look younger and fresher. And as we grow older, the body's ability to produce collagen, it decreases, hence the signs of anti-aging. And African women are actually in this thing. They've taken it by storm. And interestingly, it's the younger group. My average age group for my clients is around 32. I see women from the age of about 19 or 20 to about to their 50s. But the majority is women in their 30s. And I think it's a good move. Prevention is better than cure.
What sort of conditions have you seen, severe conditions that you've seen in your time doing this, and how have you helped them with the work that you do?
Like we touched on the issue of self-confidence. Those women are the ones who will come crying because they've got the faces full of pustules. They've got to put on thick layers and layers of makeup. I see a lot of acne, and that is followed by scars or pigmentation as a result of the acne. I see a lot of that. And also in terms of body, we do not only skin or face, we do body as well. Many women are coming needing to lose weight, and they need to sculpture their body. The issue of fat bellies, is also another epidemic in my clients. Many women, especially after childbirth, but even those who haven't got children yet, have got problems of umkhaba. We focus and we're getting a lot of clients that we've got to treat for umkhaba. And it's been yielding good results. We use both lipolaser and lipolysis injections for umkhaba.
All right, Dr. Nandi Mbau, thank you so much for your time. Really appreciate it. That was Dr. Nandi Mbau of Dr. Nandi's Aesthetic Medical Boutique, talking to us about medical aesthetics, confidence, and women empowerment, specifically in that industry.